Hey everybody! This video will be you hanging out with me at work. I was able to interview one of my coworkers, and her and I were going to keep it 100% real with you about what you need to know as a new nurse. Okay, I'll ask you. Hey everybody, this is Yvette. She's going to talk to you about her first year of nursing. Talk about the unit you worked on and if it was somewhere you planned to be. Like, did you get the job you had wanted?
No, I didn't get the job I wanted, but I took the first job that was offered to me. Because I just needed to start working to pay back my student loans.
Right.
And it was in a long-term acute care center. So everybody had wound vacs and stage 4 wounds and pretty much total care, and everybody had VRE. And first question is, did you love or hate your first nursing job?
I hated it. I hated it so much that they fired me. I got fired from my first nursing job because it was a place where all the nurses were the same. The culture was you had to talk like this, you had to dress, wear certain scrubs, you had to do everything a certain way. Everybody hung out together, and I didn't want to do any of those things. I just wanted to come in and do nursing the way I thought it should be done, and they didn't like me very much in my first.
So how long were you there for?
I was there 3 months.
And did it take you long to find the next job?
No, I got hired like 2 weeks after I got fired. Did you love nursing school?
It was very difficult to get through, but I'm glad that it's over.
So when you graduate, what are you going to graduate with?
An ADN degree.
How long did that take?
Took me 2 years. The nursing portion took 2 years.
So what's the best part about working as a CNA during nursing school?
The best part is about my position right now is I get to see the whole picture of what goes on in the hospital. On the desk, I'm entering orders, answering call lights, dealing with patients' families, dealing with the nurses, different units.
Well, ultimately, the nurse has to keep in mind that she's responsible for patient care. So if you do have a CNA who's working for you and they're not willing to work with you, then you have to understand that ultimately you're responsible for doing whatever it is needs to be done to deliver good patient.
Yeah, I mean,
but you could also take the CNA to the side in private and discuss it with them, because we're all adults, and so find out if there's an issue, or maybe they're not. Maybe you need to do some teaching. Maybe they're not familiar with what you're asking them to do. There's no telling.
I experienced that a lot because I look young. So there's CNAs who have been CNAs for 20 years or longer than I have been born. So when I come in and I have to give them delegation, they don't always take it well. So you just have to be professional about it. And again, you have to assert yourself as the authority. So if you ask somebody to do something that's within their scope of practice, they need to get it done.
The teaching opportunities, some of them want to learn. And so if you are willing to take the time to communicate with them, it could be a good teaching. Would you be willing to teach? Like, if the time permits, do you have time to teach?
No, I don't have time to teach.
I think the biggest mistake that new nurses make is medication errors. You know what? Can we stop?
No.
I think the biggest mistake that new nurses make is medication errors, simply because they haven't learned time management yet. So they're rushing around a lot, trying to get stuff done, within the time constraints, and they're not taking the time to review the 5 rights, which are always very important. And that's what I think the biggest mistake is, that they need to slow down, do time management so that med errors don't occur.
Well, what's the biggest mistake you ever made?
Medication.
Yes.
And what was it? Tell us about that.
The other day, it wasn't a med error, but I hung my piggyback lower than the maintenance line, so it wasn't going in.
Right.
And, you always are gonna just make little mistakes. But a medication, that's not a medication error.
I think with new nurses, one big thing to remember is it helps to have a sense of humor and not to be so uptight, because the patients already have an elevated level of anxiety. And if you can come in and break the ice, and when you show confidence and you're calm about what you're doing for them, that kind of passes on to them, and they can relax.
Prepared. So, sometimes you have to come into work early, and you have to come in there and you have to get your assignment, and before you take report, maybe you have to look through the charts, maybe you have to look up words, or look through their medications and figure out what you don't know. But you definitely have to come in being prepared. because you're licensed now, you're responsible. Don't come in and think that somebody else is going to do your job for you, because they're not. Nurses are not like that.
And do you think it's okay to let the patient know, hey, I'm not sure about this drug, I have to go research it and I'll come back?
Definitely. Never say, well, I don't know. Just say, you know what, I'm going to go get that answer for you, or I need to look over your chart again. You don't have to know everything.
Okay.
You don't have to go into the patient's room knowing every detail about
The
their
biggest
life.
thing was learning how to do time management, that I wish I knew that how to prioritize things.
Mm-hmm.
And the second thing was learning how to ask for help and not being afraid to say that you didn't know something.
Right.
I am nervous about getting a job, but you have to put yourself out there, and you have to, I feel like the people who work hard, at getting, their foot in the door somewhere. I feel like nursing school I was expecting it. It was hard, don't get me wrong, but I feel like people kind of scared me a little bit too much.
Come on. How can new nurses make a lot of money?
How can new nurses make a lot of money? First of all, a new nurse needs to have at least 1 year of experience taking care of medical surgical patients, preferably with cardiac telemetry experience, because you'll find that all over the nation. And then once you've had a good solid background in med-surg, then you can apply for licensure in other states so that you can start doing travel nursing. And there's a lot of money to be made out west and up north.
Oh my goodness, there's so many opportunities no matter what you do. I mean, just like you said, get experience, get that 1 year experience, or even 2. Because some nurses need 2 years, depending on where you work. Get medical surgical experience, figure out how to deliver a baby or resuscitate children, whatever it is you love to do. Just get that experience and get any kind of certifications or licenses that you can. That's going to make you very marketable. Don't get stuck in home health care and think you're going to be a traveler, because you're not.
And so by certifications, would you recommend that most nurses continue with their education and go back to school?
Yes, definitely. There's going to be a huge market for master's prepared nurses in the future, as this other generation, the older generation, is retiring. There's going to be a huge gap in employment there. So if you can, go to school. I mean, if you have to go online, go online. Don't make people think that one degree is better than the next. Just get the education.
And what are your ultimate education goals?
I want to get in academia still, so somewhere at a university I can teach. I think that would suit my personality, and I think I would like it. Thank you for being a part of my video.
Yep, I know some really cool people, and we're going to keep it 100% real with you about what it's like to be a nurse. See ya!